This new technology that we're seeing come out in the field of rehabilitation is really advancing the limits of what we can provide our patients. It's giving us opportunities to provide more intense therapies in a shorter amount of time. The therapy program really is just a component in our overall interdisciplinary rehabilitation program. We provide a holistic program, so we're not just treating a diagnosis. We're treating patients whose lives have been interrupted by an injury or an illness.
The patients, when they're on these machines, sometimes very excited to be doing it, like they're playing a game, and it's not like they're doing work, even though they are, and they're also still able to get the benefit from it. It's something that they enjoy very much, but also from a functional side of things, it's something that we integrate along with the traditional therapies to help them functionally improve as well.
So there's different technology and equipment for our different diagnostic populations. So the equipment that we might use with our spinal cord patients might look different than the equipment that we're using with patients who've had a brain injury or a stroke.
The Armeo Spring is a robotic device that works some virtual reality into it. We use it with our patients that have had a stroke and they have a weak side. We can put their arm into it. It can work on their range of motion, work on their strength, work on their coordination. It can work different joints within their arm, whichever ones that we need to focus on. Some patients who you think would not even be into these games really end up enjoying the games a lot. And before you know it, their arm is starting to get a lot better.
So we had set her up in this Locomet machine. We fit her to this harness, and what it is it's a robotic exoskeleton system that we hook up to their legs that kind of walks them through the gait cycle. It kind of gives that input to the brain of what good walking is, and it can relearn sort of that pattern.
We're using the Bioness H200. This goes on their arm. It's functional electrical stimulation that stimulates his muscles to contract in his arm. It lets us work on opening and closing his hand. We usually start out pretty simple, and then as he gets more movement back, we can incorporate more function into the activities.
But it helps me remember what my arm's supposed to do.
I think we've been very excited both here at the hospital as well as with our patients seeing the new equipment that we have. We're blessed to have a wonderful crew of physical therapists, occupational therapists, and speech therapists. It's a pretty intensive program. We do at least 15 hours of therapy throughout the week. Each patient usually has a therapist that follows them pretty much throughout the course of the hospitalization, so they know them very well.
We strive to give excellent care, and we strive to be the best in providing rehabilitation. So I think it gives us the tools we need to really be the best in what we want to do.